So recording is started. So my question from you is, anybody of you have tried to assess the viability of any of the idea I shared in the group? Okay. One person message. Uh, Khalilullah, Khalilullah, I have just added you, and I think you're not added in the group yet. How, about which idea are you talking about? And Dr. Murphy, जी वाइबिलिटी को चेक करने के लिए कम से कम 3 RCT जरूरी है. Yes, but I have shared, I think, more than 10 ideas. So my question from you is, has anybody tried that? Okay, this is the topic Asad gave us, and now we will just make a try to check if the topics are, if any of the topics are viable or not. Okay, so okay, I will try myself. I will try myself. Where's Tuhid? Tuhid, ask a question. I think Tuhid joined the class. Tuhid, ask a questions about specific, I think, infracilic or supracilic, something like this. He was asking about questions about this topic. So I thought maybe he have checked the viability. Anyhow, screen is not yet shared, so I think I have already. No, this is not. This is okay. I do not one guess. Okay, so I've already tried. Few people able to see my screen? Oh, I didn't share yet. Let me share it. Yes, so you can see this is the idea which I have checked. Control C, I will Control C it, and so okay, so this is a topic about, like, I did not have the opportunity to read the full text. I just have the idea that they are comparing two things. One is the narrow aortic diameter, and the other is the normal aortic diameter, and they define the narrow aortic diameter. Some study define it when it is less than 20 millimeter. Other study defines it to be when it is less than 25 diameter. Sorry, 20 diameter less than 25 millimeter, right? So that's the definition of narrow paravisceral aorta, right? Anyhow, so this is the first study which is published in February 2024, right? So if you directly go to the results section, so there are all patient, and they classified further, they subgroup the patient on the basis of whether this is fenestrated endovascular aortic repair or it is branched endovascular aortic repair. Let me simplify the thing first. Actually, I hope you all have enough idea that in the aortic aneurysms and the aortic complications, there were initially open repair. By open repair, I mean open surgical repair. It means that the surgeon would cut the sternum by, I mean, that's called the median sternotomy approach. That was called as open repair, right? But after that, the revolution, I mean the technology advances, and then come the endovascular approaches, right? So, and the endovascular approaches, we have the complex endovascular approach. So if anybody like ask you what is complex endovascular approaches, so in complex there is a fenestrated and branched, right? So uh, when we are working with the fenestrated and the branch, F fenestrated and the branch endovascular aortic repair, in this case, like what will be the effect of the narrow aortic diameter and the normal aortic diameter, right? So the thing is that this study not only classify all the patient on the basis of narrow paravisceral aorta and no narrow. No narrow means normal, right? So after that, they classify the patient of FEEVR and branched EAVR, right? So that's the baseline table. Remember, there are certainly you will find some tables in the paper. One will be called baseline tables. In the baseline tables, the authors usually mention the age, the male sex, female sex, like the baseline properties of the patient before any intervention, right? And the second table usually for the outcomes or anything else. So let's not talk about this. Like our main goal is to look for different ideas. So the thing is that like whenever you are new to any study, like let's say I know most of you will be new to this paper, right? But the thing is the approach will be to read the introduction if you have full text, right? If you don't have full text, then you can give it to chat gpt, that you can copy the abstract and give it to the chat gpt and said the chat gpt, can you please explain this to me in the simple and the plain english? By that way you will got it. If you have full text, then you can read the introduction, like what they are talking about. So in the last 2 decades, uh, endovascular treatment of this and this evolved thanks to its low and because of endovascular approaches low perioperative mortality and compared to open surgery. This is not something, however, there remain anatomical aspect they that may represent criticism of technical success and target vessel instability. Okay. uh, Anatomical related to the lack of the space of the main aortic graft, hindering correct orientation, accurate deployment, and bridge. Because of this factor may particularly evident in some cases of directional out branching favoring the inner branching in this particular anatomies. Early outcomes of novel off the shelf in the endograft of the EN site. So these two references were not like, it's not something that we are interested in. However, to date, only parameter evaluated a narrow. However, to date, the only parameter evaluated for defining the narrow artery is transverse diameter less than 25. This factor is regarded with uncertain outcomes with outer branches and pattern of administration are unclear. Okay, so outcomes of multi-branch off the shelf uh, with narrow internal aortic lumen. So this is the paper which is also related to our topic of interest. I mean, in the narrow internal aortic. So the first thing is when you have a specific article and you like the very important thing I need to mention, I need to differentiate between the original topics, the original studies topic selection and the review, systematic review or meta-analysis topic selection. This is hugely different. Like I know maybe some of you, have a lot of experience, right? And original studies. So they have knowledge like how to select, and the criteria is even different. I remember our teacher said that there is a finer criteria that should be feasible, that should be low time consuming, that should be economical, that should be managed in our hospital setting, etc., etc. So that was the criteria for topic selection, right? That was the criteria for topic selection in the original studies. But in the systematic review and the meta-analysis, the criteria is absolutely different. Like what you need to do is you need to look for paper. You need to look for papers. Like I have asked, even from my mentor, from Zender Jackman, he is my mentor. So I asked him, sir, you have a lot of ideas. How do you have these a lot of ideas? So he said to me that, Asad, I read a lot of papers. So at that time, I was not, even here, the one person is present, Obey. So yeah, this is Obey. I asked him too that, okay, how you have so many wonderful ideas. So he said that I do elective rotations and I read about the papers. So the thing is that reading about like multiple papers. So like in the group I have shared, I think about 10 or 12 ideas, 12 papers like this. So maybe one, two, or three got viable. So this is the thing. The more you read about any specific field, the more you will have knowledge about that, and the more you will know that like there is a gap for a systematic review. So the topic selection for systematic review is simple in a way that you need to just look for other papers related to this, and that's how you can do meta-analysis, right? But a good meta-analysis is the one which having individual studies having conflicting result. Because for example, here the study, the reference 7, this is in 2022, right? Maybe the study have some outcomes and they will have some results, but the results may be different. Maybe they are saying that in a narrow, we have during the stunting no problem compared to standard iota, right? But maybe and this one paper, which is in 2024, maybe they're saying that, like they're saying FEEVR and BEVR are both feasible in cases of narrow paravisceral aorta and provide satisfactory target vessel durability. The use of outer branches should be avoided in case of diameter less than. So remember, in case of branch endovascular aortic, there are two further classification: inner branches and outer branches. So they are saying that in case of outer branches, you should avoid in case of NPA. So in case of narrow, in FEVR and fenestrated bridging stunt patency may be negatively influenced by NPA less than the association with aortic angulation. So I also today somewhere I read that the definition of NPA, narrow paravisceral aorta, is like diameter less than 25 millimeter, but also angulation. I think there were measured 45 angle or 30 some. Like, so that's also the definition of narrow paravisceral aorta. Anyhow, what my point was that a good meta-analysis is the meta-analysis of individual studies that individual studies showing conflicting results with each other on the similar topic, and you pool it, then that is the good meta-analysis. A simple meta-analysis, I mean, just like there are reasons like why a person is doing meta-analysis. If he is just after a publication, then yeah, just pool the available studies on a specific topic, you will get your meta-analysis. But a good meta-analysis is about studies you are combining, having different kind of results on the same population. I hope you got my point. So this is the thing. We find a new study related to our topic, and this is reference 7. Remember it, right? There is no further any reference in the introduction. So I will just go directly to the discussion. I had checked like what kind of data this paper reported. This paper reported the data for all patient stratified by narrow and normal, and furthermore also subgroup by fenestrated and branched, right? So you and also the study gave us reported the Kaplan-Meier curves up to up to 4 year, right? So up to 4 year, I mean, they have been given the Kaplan-Meier curves for different patients. So these curves are really useful to use, right? After that, I will directly go to the discussion and I will see which paper they usually like. They have reference and what they say about that, right? So there is nothing they mention. There is two things. However, the manufacturing companies do not specify. Who is the user? Okay. So, however, the manufacturing companies do not specify the instruction user and limit the establishment of this market specifically 24 minute and 25. This is 8. Comparison of anatomic feasibility of three different multi-branch of this and 9. Atomic feasibility of new initial to develop this. In our experience, NPA alone, narrow alone, intended in the inner branch wall less than the vector is not causal limited at however, it is interesting to note that early target complication in NPA suggesting although feasible this in NPA still represent a challenging, especially in the atomic regarding this 7, which are already the 7 studies already in our notice. Okay, what about they're talking about the 16? A narrow true human as dissection or a narrow iota because of aorta complex primarily composed of this additional space in the space once and graph space in the breathing component been adequately expanded after ballooning. The situation in contrast to reason the situation contrast with the reason why we found narrow calcified wall has a higher rate of this for outer branches in comparison with the inner branches because of the lack of space of the main graft. Similarly, Abbasi et al. Reported 100% technical success and 100% 12 months patency rate in their preliminary clinical experience using custom inner branches with a narrow. So what about 16? 16 is in 2021. So we have 16, we have 7, and we have this paper, right? Overall, FE, where the vast majority of target vessel and stability is reported in large series 17 to 19. Reporting standard of invisible aortic repair. Impact of gap. Impact of gap distance between fenestration and this and this and this. Evolution of physician modified with this right. Evolution from physician modified to company manufacturer and over to retrieve parallel and the record donor aneurysm. Maybe these are somewhat related to a topic, but now neither I have enough understanding now. For now, I will not go to that because they are not directly related to something. The angulation is indicatively predictor of TVA and VR is already discussed by this angulation. What they are talking about angulation. Effect of aortic angulation and outcomes of this and this and this. It's published in 2021. Our finding may help the operator finding PRVM for this and perform intraoperative in 20. Possible added value of intravascular ultrasound. And if we are in the case of NPA currently retained, so they are usually considered excessive aortic diameter may represent an unfavorable scenario, and if you are considered with excessive gap distance between the 13 geometrical constant 18 impact of gap and what about 21 from 2035 hours and ability of communication with the neuron and the influence of the study limitation. Okay, so from this study, I got to know about two other study. One is 7 and the other one is I think 16 or something. Yeah, 16. So 7 and 16. What I need to do is I need to further look for the paper 7 and the paper 16, right? Yeah, let me see who it is. Japan. So let's see. This is 16. Let me download it. Early outcomes of Jotek, inner branched endograph and complex this and this. Now I don't know what's mean by Jotek, inner branch endograph. The same case will happen with you. Uh, like uh, 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 I am doing this like in this way because you will have to face this kind of haphazard in real life while looking for idea, right? So what they are saying, complex aortic angiography involved include this and this specific challenges existing reported outcome of inner branched review what they did. Total of they can adapt it in this and this. They really chosen for this. Uh, Let me see directly come like, what the data is about. Oh, seven, seven. Actually, I don't feel this study is have enough data about this thing. Early experience with the use of inner branches and vascular repair of complex and abdominal repairances. No, I don't feel the study have enough uh things which help us. Right. I'll go back with the study 16. No, sorry, study 7 and see how it is. Outcome of multi-branched off-the-shelf stent in the elective and emerging and executive complex aortic aneurysm with narrow internal aortic lumen. Yes, that's an odd topic. And the use of this in our experience is safer. But don't directly go to the data. What kind of data group 1 and group 2? What mean by group 1 and group 2? Usually they mention this in the method section. Here it is. Patient with internal aortic lumen less than 25. Now they divided by 25. Were placed in the group 2. So this is narrow, and the group 1 is the normal. So narrow having 22 patient. No, 28 patient, and overall the study having 48 patient. Does this is the procedural data. This is the outcome data, early result. I think this is the late result. All cause mortality. Okay, no difference. I think this study don't have any cam curve, which is bad thing, but anyhow, the study do not have any Kaplan-Meier curve, but having late result and this and divided by two groups. Furthermore, I think this study is specifically multi-branched. So this is not on fenestrated. This is specifically related to branched. I mean BEAVR, right? Yeah. So what's next? I have searched about this and let's see. Search it someone. This is uh, Cairo Ferreira, right? Let's see which one is this one. So idea viability and these things, this takes time. You have to be patient. And this is in the January 2026. So we have one in the January 2024, right? Let me see. This it's been published 2022. Okay. So the previous one, the first one. So use this reference. So you get one curve. Piazza 2024. So 2022, 2024, and now 2026. We have three papers, but the more it is, the better it is. Like the more we have, the better it is, right? So this is about 2026 outcome of illustrated and branch. Here it is both. Furthermore, if we have data, we will subgroup it by fenestrated and branch, right? Fenestrated and branch vascular aortic compare and patient with a narrow flow lumen versus standard flow lumen of parallel aortic. Okay, does this having any cam curve? What's mean by SFL? Let me see. SFL. Standard flow lumen. Okay, standard flow lumen is a 3D pair. Normal flow 35, total 138. Okay, this is I think procedural characteristics, and this is outcome characteristics. Yeah, and having can curve for what? Target vessel stability. The other one reported can curve for what? This is important. Like for what outcomes we have in cam curve, because we can pull this target vessel instability. What was this one? Target vessel instability. What? What do you mean by this? Is it different target vessel instability? Okay, I think it's same, but I will ask GPT. I will ask senior author, but I think it's same. What's they're saying? They're saying it's no difference between the two things. And what's they are saying? They are also saying there is no difference. So I mean, it's just a viable topic, you can say, because we have three studies and we have the criteria. Actually, the criteria is actually when we have three studies, that's okay. We need to go, but I said to you that we need four because I I have the experience where I have I think five papers, and still the senior author saying that also that's like we don't have any novelty. What the paper was saying or meta-analysis is saying the same. So like also what you are contributing to the literature. I yes, I remember I did stats, I did everything, I shared the stats, I result with doctor, and he said to me like so everything is same. We do not have any particular I mean something new, something good result. So I then I mean, give up on the idea. So, now we will again read the introduction of this one, and we will see what kind of paper they reference. Because now I know that I have two papers. One paper is of this author, which is I think Piazzi, and the second one is of this author, which is Ferreira, right? Two chemicals. Don't have it. Not who is this? Muhammad Khan. Okay. uh, like you have seen like now for the checking of the viability I have just one idea. Now it's 10:39, so I know I can't uh, do all the ideas viability in the front of you, I mean in the class, but the thing is I can show you the way how you can search for ideas on and also after this paper I will look for the meta-analysis on this topic because this is important. Uh, I, I I want to get more studies, but the important thing is if these studies are not used by any meta-analysis yet. And the core thing is, I think, what we need to do is we need to check. No matrix is available. Okay. What about this one? About this one? If it is having any matrix is available, I will see its citation that which papers cite this, which papers cite this, and by this I will know about yeah 26 citation. I will know completely the related topics will even the new studies will cite this previous papers. Oh, Systematic meta-analysis and individual repair of non-elective this and this in aneurysm involving visceral arteries. Systematic review in meta-analysis on endovascular repair of non-elective thoraco-abdominal aortic aneurysm involving visceral arteries. I don't think, now I will check it. I will check if this does not interfere with our topic. But I don't think this is on our topic. Result of Italian registry novel inner for complex aortic lesion, technical pitfall, early result and outcome of predictor, of the shell T branched, systematic review meta-analysis, inner branch of the shelf, inner branch of the shelf technology for chronic post-dissection thoraco-abdominal aneurysm with narrow true human. And even this is further cited by 6. Oh my god, let me see this. Let me see this. Control C. I'll see it later. First, I need to complete its citation. Systematic review and meta-analysis of short-term and mid-term outcomes after use of T branch of the shell. This branch endovascular aneurysm with inner and outer branches. Okay. Branch endovascular of chronic post-dissection institution. Okay. Okay. Huh? Yeah. Which one is this one? T branch by partial deployment technique in the endovascular repair of complex aortic and thoracoabdominal aneurysm with narrow or severe inguinal. It's nice. This is nice. Okay. We don't know who is. I need to stop the presentation. Stop sharing. And leave me who it is. I'm sorry. I'm sorry. Who is this? You're saying I've done registration, but I've done edit in the group. I don't know. Anyhow, let me share the screen again. Sorry for the disturbance. Share it again. Okay. Now, I also need to select this one. Control C. And this is another thing which I need to check. Systematic meta-analysis outcome of adventa. This on this. Endovascular renal and thoracoabdominal aneurysm with inner this and this. Okay. Intraoperative, this long-term outcome of this and standard branch repair will complex in young and fat patient. Okay. Endovascular repair. Okay. Urgent endovascular. Performance of new generation body extendable graft. Urgent outcomes of outer branch versus inner branched. Okay. I don't think for now any meta-analysis on this topic, but now I'll search the new topic, specifically the new to study, which I find by a citation. What's the study? Which one is this, man? Let me see its full text. And which one is this one? Let me see its full text. What's their publication date? This is in 2025, and this is in 2025. Okay, Gignatum. I think this is a single arm study. No came curve. That's really sad. At first, when I don't know the came curves things, I would fear if any paper have any came curve. And now I really said if a paper don't have any came curve. What's its consecutive on prevent urgent repair for complex in this by T branch and this technical success, this and this and this. In case of narrow or severely ungulated, okay. So I mean our population can be modified, narrow and severely ungulated iota. And unconventional the partial deployment technique is unconventional option for deploying a program target accuracy for the upper in case of this and this and this aim of the study to the outcome of this and this 33 cases analyze their acceptably degenerative 23 this okay off on 28 generated scheme this for this is safe with narrow or APA. What mean by APA? Mean by APA? Okay, APA. APA I mean it's angle. So with narrow or ungulated, I mean its whole population is narrow. In method section, usually they describe their population. Make this if we read it up. Inclusion criteria. Present clear proposing this in this innovative branch in the presence of NPA, narrow, parallel, or in case of English. So the thing is that their population is the one what you want, right? But the thing is they are not comparing narrow with the normal. They are just looking. I mean, reporting the result of narrow, paravisceral, or ungulated. So the thing is that the trick I want to mention is in the meta-analysis of this kind, like this is relatively a novel topic. So in this case, if I strictly uh, like systematic review. Systematic review actually means a review of the literature on a specific topic, which is done in a systematic way. So if I'm letting go the single arm studies, like this does not make sense. So that is why I think this is the good way to not let the single arm studies. So what you will do, you will do a meta-analysis of single arm along with a meta-analysis of double arm. Maybe we find a double arm studies like 5, and uh, what about single arm? Single arm will be like uh, the 1 5 which having like they will have an arm of narrow, right? And the other maybe 2 studies we find just single arm. So in the single arm we will have 7 studies. I hope you got the point. So although this is just focusing on narrow paravisceral aorta, but I will not let it go. Right? This is important. Like how 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 can I ignore the 33 cases? Like I can't ignore this. What about this? This is in 2025 chronic cold dissection aneurysm with uh, inner branch with narrow true lumen. What they are comparing. Mm, I also think this is about for similar meta-analysis. I mean, just important data forward. So the thing is that, I mean, I have to study more this topic in detail. Yes, I have to study more about the topic. I know I have some kind of viability, like, uh, like, now I'm sure on this topic there is no meta-analysis. Like, you'll say that, how are you so sure about this? So my answer is, I'm sure because I'm sure because this is a specific study on this topic, narrow, and even there, this is a two-arm studies. They're comparing group one and group two. Group one is narrow paravisceral, and this is not cited by any meta-analysis which is comparing narrow versus normal. This is not cited by any meta-analysis, right? They, like, for example, now if I'm doing a meta-analysis on narrow versus normal, obviously I will start the I will cite this paper. This is 100%, like, I will cite this paper. And uh, when I will cite this paper and their citation or meta-analysis, like, anybody will see our meta-analysis, right? But here I'm not seeing any meta-analysis. So the thing is that one thing is clear, there is no meta-analysis in this topic. But the second thing is not clear. We need to search more studies on this topic. How can we search? Like, the first thing, as I said to you, that we need to uh, check the reference of the articles we just got by from this one article. From this one article, we got like 3 or 4 articles, right? From the Piazza, we got 7, 16, and then from them we got some other articles, right? Where is the 2026? I think this is, yeah. So I need to look for some more article in composition. I'll just directly go to its references and see. X, so the next step will be, like, I'm sure there is no meta-analysis, and I have, like, the viability that I have 3 studies. Now I need to make a search strategy for this topic. How will I make a search strategy? This is important question, and let me answer this. Furthermore, like, eh, like, at least you have 3, 4, and 5 studies. After after that, you need to make a search strategy, right? Because different papers will use different different paper maybe use different title, and, like, search strategy basically means in the PubMed, when you are searching something in the PubMed, when you are searching something, you need you're searching for any topic, you need to have clear words, clear keywords, right? From where you will got the keywords? You will got the keywords from the study you have for a meta-analysis. Like, if I am doing a meta-analysis comparing narrow versus normal, then it means I have studies. Without studies, uh, like, I don't think about even this kind of ideas, right? So I have studies, I have at least 3, 4 studies. What I will do is, I will copy their title, right? I will copy their title. Like, this is Piazza, and I need to, like, copy it. Why I'm copying the title? Because this is important. This is important. This is really important. And this is Delusa. Okay. After that, I think we have gone from Windows. Yeah, Ferrer. What's next? This is Ferrer. I think we got some studies from here. Yeah, this one. And the one other was also I think single. So I have copy. What's this one? I think Gilberta. Yeah, I have this. And okay. So I have few studies. Let's say, for example, all of them are what? All of them are double arm. Let me make this small. And, and okay, so the thing is that you need to make blocks. You need to make what? You need to make blocks. Like what I'm seeing in these five titles, right? What I'm seeing. Effect of narrow paravisceral. Okay, so narrow paravisceral. Okay, the target vessel instability after the fenestrated and branched. Okay, and fenestrated and branched. Comparing patient with narrow flow lumen versus standard flow lumen of the paravisceral aortic segment. Cut of multi-branched off-the-shelf stunt graft and elective and emergent repairs of complex nerve hair instead of fenestrated and branch. They are using the word complex aortic aneurysm with narrow internal aortic lumen, paravisceral aortic lumen. Here is narrow paravisceral. Here it is narrow flow lumen, inner branch of the shelf technology. The shelf technology uh, for chronic post-dissection thoracoabdominal aneurysm with narrow lumen, narrow true lumen. I think this is not the narrow true lumen. This is I think not related to our topic, but I will read about this further. But my instinct is saying this is not something related to our topic because the true lumen and false lumen this is usually in dissection, and this is something else. This is something I mean different from our topic. But I will yeah. Now this is on our topic: narrow or ingulated paravisceral aorta technique, endovascular repair of complex aorta thoracoabdominal aneurysm. So complex aorta, aortic thoracoabdominal, and endovascular repair. Now I need to make a search strategy which having at least two blocks. Like sometime like our teacher, our mentor, Renderson Cardoso, he teach us in a way that he was saying that you need to make a block for population. Like what's your population? You need to make make a specific block for your population which having synonyms of your population, and another block for intervention, another block for comparison. But the block for comparison or control, it may be sometime present or sometime not. Like here, we, if you see, there are most of the studies did not like mention the standard flow. Just one study is saying standard flow. Maybe another study. No, no, yeah, just one study is saying about standard flow. So although my control is standard flow, but that is so common that nobody was talking about this. Everybody is saying about narrow. So this is so trendy, so unique that everybody is talking about this. Nobody and nobody is talking about the standard. So that's the thing. Now in this case, I just need to make two blocks, blocks of population and blocks of intervention. I don't need to mention my standard flow, right? So, so this will be your population, right? Or synonyms of your population, right? And after that, and your intervention and synonym of your intervention, right? So now even I don't have enough knowledge like what are the different names, what are the different names in the literature for narrow paravisceral and for the paravisceral, mm, like ungulated. What I will do is what I do. Let me share my secret. I usually do it like I usually am chat GPT and saying this, hey chat GPT, like uh I'm doing a systematic review, right? And I have some studies, mm, comma. Here I will paste titles of few studies and by and help me make a search strategy so that I not miss any study, right? Study one. So now you need what, like you just need to copy the titles, Control C, Control V, and study two. We will just take an idea from here. I know sometimes like when the ChatGPT gave us result, you won't blindly just put it in the PubMed. You will modify that. You will modify it in the advanced search in the PubMed. So this is one thing. Furthermore, testing your search strategy. When you made your search strategy, you need to test it. How you will test it? I'll teach you this, like how you will test your search strategy so that your search strategy is good enough or not. Right. So first thing is making a search strategy, and the second thing is testing it. So see, study what? Study five. Uh, yeah. Make sure to use a lot of synonyms, right? And just go. Okay. The key challenges here is that the other describing same anatomical concept using many different narrow paravisceral, narrow flow lumen, narrow internal aortic lumen, narrow true lumen. True lumen. As I said, I will read the article about true lumen as my instinct is saying this is not the same topic what we are studying about. This is some kind of difference. So I need to check the true lumen article. Severe related chronic post-resection true lumen. Yeah, severe chronic post-resection and true lumen. These are something style anatomy, constraint lumen, reduced lumen diameter. So FEVR, branch DVR, FAT, branch of the shelf, inner branch, military, this and this. So search strategy, procedure block, anatomy block, device, or both. Control vocabulary. How they arrange it. First they arrange the and after that the anatomy. I think what we need to do is yeah, exactly. No, narrow, small, constraint, and this is good, but what my mind is saying we need just to make two blocks. One block will be just like here it's mentioned. It will be for the complex different synonym of complex endovascular complex endovascular aortic repair, right? And the other will be for the anatomy, the narrow, the narrow thing, right? So I think we need to have just two blocks, right? This is so. Let me go here, make it small. So I have different F E V E R. No, no, V E R or capital R, because you are saying that F a study used F E V A R or F a study used in the title B E A V R, right? Like for example, this specific study just use where is it? Where is it? Where is yeah? This specific study just use branch. So I mean, this study didn't use anything like FUR. So that's why we are putting R between the things that we are saying that if a study mentioned in the title this or this, we need it. You need to pull those studies, right? Or VE or VAR, right? After this, capital R, fenestrated endovascular, branch endovascular, fenestrated and branch fenestrated strand graft, the abdominal, thoracoabdominal, complex aortic aneurysm, T branch, and inner and off the shelf TIAB. Okay. Uh, After that, you need to search for narrow reduced introgenics. Okay, I think it's really better. Like why we are putting it here, we just need to control C it and let me make the place for it. Do this, control V this, and go to PubMed Advanced. Uh, you need to just click on the Advanced and okay. When you are like making your search strategy, you need to mention like whether you are whether you are looking for all fields for a specific term, or you are just want the specific term and title in abstract. As here, I just need this entitled in abstract. So what will I do? I'll just SEVAR. One thing remember, when a word is acronym or just a single word, no need to no need to occupy this in the quotation. Like there is no need of quotation. You just need to click on the add, right? After that, the second one, B E B A R, title and abstract. But you need to like you want that you are adding these things with the help of R, right? So add with R, and after that fenestrated. Now this there is two words like fenestrated and endovascular. These are two words, and you need to combine this. So how you can do this? Do this via quotation, right? The importance of quotation is this: whenever it's written, it will be pulled as a block. Like if a study is mentioning fenestrated, and here it is here between the fenestrated and vascular, there is something else. The that specific study won't be pulled by this. I mean, when the fenestrated and the vascular are just like consecutive, just one after other. So that's the importance of quotation. That then that specific study will be pulled, right? Abstract, okay, and with all. Similarly, branched, and you need to do the same process with the other, right? Branch vascular adds two words, so you need to press the quotation and each and everything, right? After that, I think uh, I should combine this narrow with the true human, right? Let me see. Let it reduce. narrow fluid lumen. What if I just combine it? Narrow and lumen, narrow lumen and small true lumen. No, no, narrow lumen, reduced lumen, limit angulated uh, hostile. But I like their approach. Their approach. For example, here it is narrow internal aortic lumen. Narrow and aortic lumen is when you're pulled. I just need to make it quick. Relatively branched. Uh, just bear with me for 3 minutes. Stent graft. Straightened. I think I don't need this. Complex. Complexity. T branch. Another branch. But she didn't mention the outer branch. I don't know why. Because it's also a top. It's also a outer branch. And after that, inner shell. So sorry, of the shell. This is a topic you frequently. Sorry, this is a word you will frequently notice and specifically endovascular or vascular surgery. Okay, so when all the words are connected by this, right? Okay, you can use the mesh word for specific words like. But before the mesh words, you're using any mesh word, you need to check whether the mesh word is exist for this word or not. I will teach you. I mean, so what you need to do, you need to just get history. Oh my God! Oh my God! Oh my God! Where did I make mistake, man? I make some mistake. Let me see what kind of mistake I made. What's this? This is a mistake. Mistake. Control Control V. Let me see where I did a mistake. One mistake is this one. Where are other mistakes? I don't think we have other mistakes. Yeah. So yeah, there was one mistake. Okay, now again, I have made another. I need to make another block of narrow. Add. Are you people with me? Yes, Ahmed. Okay. So narrow, small, add with or, and reduced. These are single words, so I don't put quotation here. And constrained, constrained, limited, 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 ingulated, GULATED, ingulated, and hostile, HOS, honesty, hostile, right? So after that, what you need to do, you need to add this. Oh my God. Yeah, add this into your history. After that, human, add true human. Not true human. I don't want of true human. As I said, I'll check whether this topic is related to ors or not, but I don't think so. Dual human, biotic human, there are visceral, RAPISCERL, visceral, visceral is written like this too, PISCERL. Okay, and this to history. Now we have 3 blocks, and what we need to do is first we need to add this query. Now we need to add this with end, and we also need to add this with end, right? And after that we need to, oh my God, this is too narrow. This is too narrow. We have just 74 result. By the way, it's easy for you people. Like you will just 74. I will upload these things to the Rayon, and you will do screening. But before this is important. This is important. Before this, we need to test this search strategy. We need to what? We need to test this search strategy, whether this specific search strategy is pulling those articles which we have or not. If this search strategy is pulling those articles which we have, it means our search strategy is fine. How will we test it? Let me show it to you. What articles we have? Okay, the first one, effect of narrow parameter on target. Let me see which other effect of, oh my God, effect of narrow parameter. So this is Michelle Piazza. Control C its name, and you need to write here capital and space and control V space and search it. Okay, now we have 2 studies on this. Specifically the one which we are looking, the Michelle Piazza. What's happening? What's happening? Is everybody okay? Okay. Okay. So this is thing. This was a studies like this is a study 2024, and we got it. So for now this is okay. Now we need to check for other studies, like specifically this one, Ethyrine delusa. Control C. I don't know what's Control V. Search it. Ethyrine delusa 2025. Man, what comes in started and branched? What comes in started and branched? Okay. Ethyrine delusa and Verilin. Okay, it's that one. Annual vascular surgery. Okay, after that, what we have this one, Syrophyrid. Control C. Control C. Control V. Syrophyrid. Where is, yeah, this one, 2022. Let me see. After this, what we have, we have covenant, quadrant, and neighbors wearing related. Erinko Goliath, Control C, and hotel Control V. Space and search. What's the title? Its title was Key Plan by Partial Deployment Technique. Right? So you see, it's mean a search or search strategy is pulling all the articles we have. We test our search strategy and it's okay. So what's the next step? The next step is your search strategy is fine. You just need to pull all the results on this topic, right? What? How will you like? I mean, import these references from PubMed. You need to